Question 1. Which class of drugs is most fatal when overdosed? A. Antihistamines. B. Benzodiazepines. C. Tricyclic antidepressants. D. Typical antipsychotics. Correct answer. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, are the most fatal when overdosed because they have significant cardiotoxic effects. Overdose of TCAs can lead to severe cardiac arrhythmias, such as torsades de pointes, which can be life-threatening. This is due to the drug's ability to block sodium channels, affecting the electrical conduction of the heart. Question 2. A patient receiving ziprasidone for schizophrenia develops Parkinson-like symptoms. Which medication should the nurse recommend to decrease these side effects? A. Benztropine. B. Bethanechol. C. Levodopa. D. Ropinirole. Correct answer. A. Benztropine. Ziprasidone is an atypical antipsychotic used to treat schizophrenia, but like other antipsychotic medications, it can cause extrapyramidal symptoms, which include Parkinson-like symptoms such as tremors, rigidity, and bradykinesia. Benztropine is an anticholinergic agent commonly used to treat Parkinson-like symptoms caused by antipsychotic medications. It works by blocking the action of acetylcholine in the brain, which helps to restore the balance between dopamine and acetylcholine, and alleviates the symptoms of Parkinsonism induced by antipsychotic drugs. Question 3. A patient has been started on valproic acid for the treatment of bipolar disorder. Which instruction should the nurse provide to the patient? A. Notify the physician if you become pregnant or if you are planning on becoming pregnant. B. Stop taking the medication if you experience headaches. C. Stop taking the medication if you experience weight gain. D. Use a generous amount of sunscreen to avoid photosensitivity. Correct answer. Notify the physician if you become pregnant or if you are planning on becoming pregnant. Valproic acid is an anticonvulsant and mood-stabilizing medication commonly used in the treatment of bipolar disorder. However, it has been associated with a significant risk of birth defects if taken during pregnancy, particularly neural tube defects like spina bifida. Due to these risks, it is important for patients to notify their physician if they become pregnant or are planning a pregnancy, so that alternative treatment options can be considered. Question 4. A schizophrenic patient is receiving haloperidol. Which of the following extrapyramidal side effects is the patient most likely to develop? A. Pacing. B. Seizures. C. Tics. D. Tremors and shuffling gait. Correct answer. D. Tremors and shuffling gait. Haloperidol, a typical antipsychotic, is most likely to cause Parkinsonism, which includes symptoms like tremors and a shuffling gait. These are common extrapyramidal side effects of this medication. Question 5. A patient is prescribed lorazepam for anxiety. Which of the following possible side effects should the nurse include in the patient's education? A. Barking cough. B. Confusion. C. Diarrhea. D. Increased risk of infections. Correct answer. B. Confusion. Lorazepam, a benzodiazepine, can cause confusion, particularly in older adults or when taken in high doses, due to its sedative and cognitive impairing effects. Question 6. A patient is prescribed amitriptyline for the treatment of depression. Which of the following common side effects should the nurse educate the patient about? A. Diarrhea. B. Excessive tears. C. Hypertension. D. Lethargy. Correct answer. D. Lethargy. Amitriptyline is a tricyclic antidepressant, and it commonly causes several side effects due to its anticholinergic, sedative, and antihistaminic effects. One of the most common side effects is lethargy or drowsiness, especially when starting the medication, as it has sedative properties. Question 7. A patient taking Lasix is advised to increase the intake of which of the following foods? A. Apples. B. Cantaloupe. C. Iceberg lettuce. D. Plums. Correct answer. B. Cantaloupe. Lasix, furosemide, is a diuretic used to treat high blood pressure, edema, and heart failure, but it can cause potassium loss, leading to hypokalemia. To prevent this, patients are advised to eat potassium-rich foods, with cantaloupe being a great choice due to its high potassium content. Question 8. Which medication should the nurse have available for a client who has received Versed? A. Diazepam, Valium. B. Florinef, fludrocortisone. C. Flumazenil, Romazicon. D. Naloxone, Narcan. Correct answer. Flumazenil, Romazicon. Versed, midazolam, is a benzodiazepine used for sedation and anxiety relief. In case of overdose or adverse effects from Versed, flumazenil, Romazicon, is the antidote that can reverse its sedative effects. Flumazenil works by blocking the benzodiazepine receptors in the brain. Question 9. A patient who began taking fluoxetine HCl, Prozac, 2 weeks ago asks the nurse when they will begin to feel the effects of the medication. The nurse's response is appropriate if she says, A. In another 2 weeks. B. It should only take a day or two, and you'll feel much better. C. Prozac requires 3 months to work. D. Prozac starts working immediately and should already be having an effect. Correct answer. In another 2 weeks. Fluoxetine, Prozac, is a selective serotonin reuptake inhibitor, SSRI, used to treat depression, anxiety, and other mood disorders. It typically takes about 4 to 6 weeks for the full therapeutic effects to be felt. However, some patients may start to notice initial improvements within 2 weeks, but the medication requires time to reach its full effectiveness. Question 10. A doctor prescribes alprazolam, Xanax, 0.25 mg orally 3 times a day for a patient experiencing anxiety and physical symptoms due to work-related stress. Which of the following common side effects should the nurse monitor for in this patient? A. Agranulocytosis. B. Bradycardia. C. Drowsiness. D. Tardive dyskinesia. Correct answer. C. Drowsiness. Alprazolam, Xanax, is a benzodiazepine commonly prescribed for anxiety and related symptoms. It works by enhancing the effects of a neurotransmitter called GABA in the brain, which helps calm nervous activity. One of the most common side effects of benzodiazepines, like alprazolam, is drowsiness, as it can cause sedation and fatigue. Question 11. The nurse is reviewing a client's medications and notices a prescription for Versed. Which of the following medications should be readily available for clients who have received Versed? A. Diazepam, Valium. B. Florinef, fludrocortisone. C. Flumazenil, Romazicon. D. Naloxone, Narcan. Correct answer. Flumazenil, Romazicon. Flumazenil is the antidote for benzodiazepine overdose, including Versed, midazolam. It reverses the sedative effects of benzodiazepines, making it essential to have available in case of oversedation or complications following Versed administration. Question 12. The PN receives a call from a mother caring for her infant. The PN should inform the mother that which of the following medications should be used with extreme caution. A. Acetaminophen. B. Bacitracin. C. Diphenhydramine. D. Simethicone. Correct answer. C. Diphenhydramine. Diphenhydramine is an antihistamine commonly used to treat allergies and insomnia, but it can cause significant sedation, drowsiness, and potentially respiratory depression in infants. Its use should be carefully monitored, and it is typically not recommended for young children unless prescribed by a healthcare provider. Question 13. Which of the following is not one of the 5 rights of medication administration? A. Right dose. B. Right explanation. C. Right patient. D. Right time. Correct answer. B. Right explanation. The 5 rights of medication administration are a standard guideline to ensure patient safety during medication administration. They include 1. Right dose, ensuring the correct dosage of the medication is given. 2. Right patient, verifying the identity of the patient to avoid errors. 3. Right time, administering the medication at the correct time as prescribed. 4. Right medication, confirming the correct medication is being administered. 5. Right route, ensuring the medication is delivered via the prescribed method, e.g., oral IV. Question 14. How should a nurse correctly administer a purified protein derivative test to a client? A. Inject intradermally. B. Inject intramuscularly. C. Inject subcutaneously. D. Inject through a piggyback. Correct answer. Inject intradermally. The purified protein derivative test, also known as the tuberculin skin test, is administered intradermally to assess for a delayed hypersensitivity reaction, which indicates exposure to Mycobacterium tuberculosis. The intradermal route ensures the solution is deposited just beneath the skin's surface, allowing for proper assessment of any localized reaction, in duration, after 48-72 hours. Question 15. A nurse is gathering health history information from a newly admitted patient. The patient denies any known diseases, but hands over a bottle of gemfibrozil that she has been taking for 1 year. What disease should the nurse inquire about based on this medication? A. Atrial fibrillation. B. Hyperlipidemia. C. Hypertension. D. Type 2 diabetes. Correct answer. B. Hyperlipidemia. Gemfibrozil is a fibric acid derivative used primarily to treat hyperlipidemia, particularly elevated triglycerides and low HDL cholesterol, good cholesterol. It works by decreasing the liver's production of triglycerides and increasing the breakdown of fats in the blood. Therefore, gemfibrozil is typically prescribed to patients with high cholesterol or triglyceride levels, conditions associated with hyperlipidemia. Question 16. A patient recently prescribed ezetimibe asks the nurse about the purpose of this medication. Based on its mechanism of action, the nurse knows ezetimibe is used to treat which condition? A. Congestive heart failure. B. Hyperlipidemia. C. Hypertension. D. Osteoporosis. Correct answer. B. Hyperlipidemia. Ezetimibe is a medication used to lower cholesterol levels, particularly low-density lipoprotein cholesterol. It works by inhibiting the absorption of cholesterol in the small intestine, which reduces the amount of cholesterol that enters the bloodstream. This helps in the treatment of hyperlipidemia, high cholesterol, particularly when used in combination with other lipid-lowering drugs, like statins. Question 17. A patient is admitted with an acute myocardial infarction, and the physician orders aspirin, 325 mg orally. What is the primary action of aspirin in this context? A. Blocks vitamin K synthesis. B. Decreases platelet aggregation. C. Inactivates clotting factors. D. Promotes coronary vasodilation. Correct answer. B. Decreases platelet aggregation. Aspirin works by irreversibly inhibiting cyclooxygenase 1, COX-1, an enzyme necessary for the synthesis of thromboxane A2, a chemical that promotes platelet aggregation and vasoconstriction. By reducing thromboxane A2 production, aspirin decreases platelet aggregation, which is crucial in preventing further clot formation in patients with an acute myocardial infarction, heart attack. Question 18. A patient is admitted to the hospital for chest pain, and the nurse administers a nitroglycerin tablet. What change in vital signs can the nurse expect? A. Decreased blood pressure. B. Increased blood pressure. C. Increased heart rate. D. Palpitations. Correct answer. A. Decreased blood pressure. Nitroglycerin is a nitrate that works by relaxing the smooth muscles in the blood vessel walls, leading to vasodilation. This vasodilation reduces systemic vascular resistance, decreases preload, and lowers blood pressure. These effects improve oxygen supply to the heart while reducing the heart's workload, which is critical in relieving chest pain caused by ischemia. Question 19. The physician has ordered procainamide for a patient. Before administering the medication, what is the most important assessment for the nurse to perform? A. BUN and creatinine. B. Blood pressure and heart rate. C. Hemoglobin. D. Urine output. Correct answer. B. Blood pressure and heart rate. Procainamide is an antiarrhythmic medication used to treat cardiac arrhythmias by stabilizing the heart's electrical activity. Its administration can lead to hypotension, low blood pressure, and bradycardia, low heart rate. Therefore, assessing blood pressure and heart rate prior to administration is critical to ensure the patient's cardiovascular system can tolerate the medication and to establish baseline values for monitoring. Question 20. A patient with mitral valve prolapse was administered quinidine intravenously to treat an arrhythmia. The nurse recognizes a typical side effect of this medication when the patient A. Complains of back pain. B. Experiences frequent watery diarrhea. C. Reports muscle weakness. D. Describes ringing in the ears. Correct answer. D. Describes ringing in the ears. Quinidine is a Class 1A antiarrhythmic medication that works by inhibiting sodium channels to stabilize the heart's electrical activity. One common and typical side effect of quinidine is tinnitus, ringing in the ears, which occurs in a significant percentage of patients. This side effect is related to quinidine's effect on the inner ear and auditory system. Question 21. A patient is admitted to the hospital after experiencing multiple seizures and is given phosphonitoin. Later, the patient's phenytoin blood level is found to be 19 mcml. Which of the following conditions is a known side effect of phosphonitoin? A. Agitation. B. Diarrhea. C. Hypertension. D. Nystagmus. Correct answer. D. Nystagmus. Phosphonitoin is a prodrug of phenytoin, meaning that it is converted into the active form of phenytoin in the body. Phenytoin is an anticonvulsant used to manage seizures, and one of its common side effects is nystagmus, an involuntary rapid eye movement that can occur with high blood levels of phenytoin. A blood level of 19 mcml is within a range that can potentially cause this side effect, especially if the level is above the therapeutic range, which is generally 10 to 20 mcml. Question 22. A patient diagnosed with a pulmonary embolism is receiving an IV heparin infusion. Which side effect should the nurse monitor closely for? A. Hyperglycemia. B. Lethargy. C. Shortness of breath. D. Tarry stools. Correct answer. D. Tarry stools. Heparin is an anticoagulant used to prevent and treat blood clots, such as in cases of pulmonary embolism. The most significant and serious side effect of heparin therapy is bleeding, which can manifest as tarry stools, indicating gastrointestinal bleeding. This occurs because heparin inhibits clotting factors, increasing the risk of bleeding. Nurses should closely monitor for signs of bleeding, including unusual bruising, hematuria, and tarry stools. Question 23. A patient with tuberculosis is being treated with rifampin, ethambutol, isoniazid, and pyrazinamide. The patient reports that his contact lenses turn orange after each use. What is the most appropriate response from the nurse? A. Administer an intramuscular injection of vitamin K to promote coagulation. B. Contact the physician. C. Reassure the patient that this is a common and harmless side effect. D. Instruct the patient to stop taking the medication. Correct answer. Reassure the patient that this is a common and harmless side effect. The patient's contact lenses turning orange is a well-known and harmless side effect of rifampin, which is one of the medications used to treat tuberculosis. Rifampin is known to cause orange or reddish discoloration of bodily fluids, including urine, sweat, tears, and contact lenses. This discoloration is non-harmful and does not require the discontinuation of the medication. Question 24. A nurse administers piperacillin tazobactam intravenously to a patient with aspiration pneumonia who has never taken a penicillin antibiotic. What should the nurse assess for as a potential indication of a serious adverse effect? A. Bradycardia. B. Confusion. C. Constipation. D. Urticaria. Correct answer. D. Urticaria. Piperacillin tazobactam is a beta-lactam antibiotic, which belongs to the same class as penicillin. A serious adverse effect associated with this class of antibiotics is an allergic reaction, which can manifest as urticaria, hives. Urticaria is a common sign of an allergic response and could indicate the potential for a more severe reaction, such as anaphylaxis. Question 25. A patient is receiving intravenous ceftriaxone for the treatment of pneumonia. What severe side effect should the nurse monitor for? A. Arrhythmias. B. Diarrhea. C. Nausea. D. Seizures. Correct answer. D. Seizures. Ceftriaxone is a third-generation cephalosporin antibiotic used to treat a variety of infections, including pneumonia. While it is generally well tolerated, seizures can occur, especially in patients with renal impairment or in those receiving high doses. Seizures are a serious adverse effect that may arise from ceftriaxone toxicity, particularly if the drug accumulates due to impaired renal function. Question 26. A patient is receiving a continuous IV infusion of heparin for the treatment of a pulmonary embolism. Which of the following blood tests should be monitored closely? A. Activated partial thromboplastin time. B. International normalized ratio. C. Partial platelet time. D. Prothrombin time. Correct answer. Activated partial thromboplastin time. Heparin is an anticoagulant used to prevent and treat blood clots, such as in the case of a pulmonary embolism. The effectiveness of heparin therapy is closely monitored by measuring the activated partial thromboplastin time, APTT. The APTT assesses the intrinsic and common coagulation pathways and is used to ensure that the patient's heparin therapy is in the therapeutic range. Typically, the APTT is monitored regularly during continuous heparin infusions to ensure that it is prolonged appropriately to prevent clot formation without causing excessive bleeding. The therapeutic range for APTT is usually 1.5 to 2.5 times the normal value. Question 27. A patient is prescribed dexamethasone to reduce cerebral edema after a motor vehicle accident. Which of the following assessment findings would indicate that the treatment is effective? A. Decreased urine output. B. Increased blood pressure. C. Increased response to stimuli. D. Respiration rate of 12. Correct answer. C. Increased response to stimuli. Dexamethasone is a corticosteroid used to reduce inflammation, including cerebral edema. Its effectiveness is typically indicated by an improvement in the patient's neurological status, including increased response to stimuli. The medication does not significantly impact urine output, respiration rate, or blood pressure, though side effects like irritability and hyperglycemia may occur. Question 28. A patient is taking magnesium hydroxide after meals for gastric reflux. Which of the following side effects is commonly associated with magnesium-based antacids? A. Constipation. B. Diarrhea. C. Hypermagnesemia. D. Hypomagnesemia. Correct answer. B. Diarrhea. Magnesium hydroxide is an antacid commonly used to relieve symptoms of gastric reflux and heartburn. Magnesium-based antacids, such as magnesium hydroxide, are known to have a laxative effect, which can result in diarrhea. This occurs because magnesium acts as an osmotic agent, drawing water into the intestines, which can lead to loose stools or diarrhea in some individuals. Question 29. A patient is receiving an intravenous infusion of metronidazole for C. difficile. Which rare but serious side effect should the nurse closely monitor for? A. Constipation. B. Hallucinations. C. Seizures. D. Torsades de pointes. Correct answer. C. Seizures. Metronidazole is an antibiotic used to treat a variety of infections, including Clostridium difficile, C. difficile infection. While it is generally well tolerated, it is associated with a rare but serious side effect: seizures. This can occur in some patients, particularly with high doses, prolonged use, or in those with liver impairment. Seizures are a known neurological side effect of metronidazole and require prompt medical attention. Question 30. A nurse is inserting a Dobhoff tube into a sedated patient. Which medication will help guide the Dobhoff tube into the duodenum? A. Famotidine. B. Loperamide. C. Metoclopramide. D. Ondansetron. Correct answer. C. Metoclopramide. Metronidazole is an antibiotic used to treat a variety of infections, including Clostridium difficile, C. difficile infection. While it is generally well tolerated, it is associated with a rare but serious side effect: seizures. This can occur in some patients, particularly with high doses, prolonged use, or in those with liver impairment. Seizures are a known neurological side effect of metronidazole and require prompt medical attention.